the greatest fundamental changes to their lives. But thanks to some new research, these ads are helping us learn what Americans are really worried about, truly worried about in the healthcare overhaul. And Frank Luntz has looked at that in depth. Author of the brand new book, What Americans Really Want, ... Really, he says. Here's Frank Luntz live in New York. How you doing, my friend?
Fine.
Congratulations, New York Times bestseller list, first week. That's impressive.
And if I can read one thing from What Americans Really Want, the number one priority, more than anything else in healthcare, the medical professionals are in charge, not the bureaucrats.
What page is that?
Page 231.
I will find that later today. We're going to see three spots here that you did what we call your dials with a focus group. First of all, what are we looking for? What's green, what's red, what's Republican, what's Democrat?
Republican is red, Democrat is blue, and the higher that the lines climb, the more favorable the reaction. What you're looking for is to go above 50. When the ads go above 50,
you want.
That's a success.
I see, but if you're below 50, you're not being effective. Spot number one, it's a female doctor. She's the one profile. Tell me about it.
The medical professional, not the politician. That's why this ad does best. Every time we tested a female doctor, it has gone off the charts. Let's take a look.
I've been a family doctor for 18 years, and I'm concerned that some in Washington are making plans that could lead to government control of many Americans' health care. I think that's dangerous. Bureaucrats should never be able to deny or delay the care that doctors provide. And if the government starts to take over health care, your choices could be reduced. Health care could be rationed, quality would suffer. Washington already controls Medicare, and Medicare will be bankrupt in 8 years. Despite this looming bankruptcy, some want to pay for health care reform with $500 billion in Medicare spending cuts. And look at Canada and England, where government controls health care. Patients wait up to a year for vital surgeries, delays that can be deadly. So instead of forcing Americans into the kind of health care system that has already failed, Washington needs to fix Medicare first.
Learn more at AmericanFutureFund.com.
Government should never come between your family and your doctor.
It's as though she read every one of the details, that she understood exactly what the American people were looking for. Let us fix Medicare first. Let us make sure that nothing comes between doctors and patients. And she has the compassion and the caring and the expertise of a professional.
I find what we call a testimonial in a lot of ways. Okay, you're the one in the field, you're the one practicing, you're the one most affected. Here's my story. As long as we've been doing this together, I don't think I can remember a spot where Republicans and Democrats were nearly aligned.
Particularly on something so controversial. It's because she's stating things that the American people really want. And here's the problem. That's not what's happening in Washington. That's why you've got the anger at the town hall meetings. And you've got one more ad here, which demonstrates the power of words if you don't stick to them. What Americans want from politicians is someone who looks straight in the eye and says what they mean and means what they say. This ad demonstrates that some politicians don't do that. Let's take a look.
One of my jobs is to keep track of all the disinformation that's out there about health insurance reform.
First of all, nobody is talking about some government takeover of health care.
I happen to be a proponent of single-payer universal health care.
Nobody is talking about some government takeover of health care.
A single-payer health care plan, universal health care plan. That's what I'd like to see.
The best way we're going to get single-payer, the only way, is to have a public option and demonstrate its strength and its power.
That a public option will put the private insurance industry out of business.
As clear as I can be under the reform I've proposed. If you like your doctor, you keep your doctor. If you like your health care plan, you keep your health care plan.
But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process.
With all due respect to the Republican National Committee, who's the sponsor of that ad is ineffective because the American people don't understand. They see these comments back and forth, but it's not put in perspective. They realize that politicians are saying one thing and doing something else. And by the way, as part of that, they're furious, and you saw this in the town hall, that these politicians are creating these 1,000-page legislation bills and not reading them.
Yeah, we've heard that time and time again. But normally when you juxtapose the words of someone with the words that they've said previously, it can be effective. Why didn't that work?
Because they didn't know which one the politicians meant. They didn't know if they meant point A, point B. You'd think that advertisers would understand that, and you'd think politicians wouldn't, within the same year, say one thing and do another.
We can understand it, too, because we covered every day, and Linda Douglas with the White House is the one who opened up that spot, and we recognize her immediately. 90% of Americans probably do not. Spot number 3, what are we going to see here?
This is interesting because you also see a different break between the Republicans and the Democrats. It's also an innovative approach to the healthcare debate. Let's take a look.
They won't pay for my surgery. What are we going to do?
But, honey, you can't live this way.
And to think that Planned Parenthood is included in the government-run health care plan and spending tax dollars on abortions. They won't pay for my surgery, but we're forced to pay for abortions.
Our greatest generation denied care. Our future generation denied life. Call your senator. Stop the government takeover of health care.
You say what? One of the
most partisan ads that we've tested in this entire healthcare debate. Republicans care that they're taking Medicare money and putting it towards the possibility of paying for abortions. Democrats find that charge offensive, and they fought over it in Washington. It is unclear whether that's in the legislation. And, Bill, here's the problem. There are so many different pieces of legislation, so many different points that we don't even know what's in it. Organizations that are so-called truth tellers, truth squads, they can justify what they say based on one bill, but ignoring what's in another bill. It is chaos in Washington, and it's one of the reasons why the Americans are so fearful.
But that last spot, there's a difference between method and message.
Yes.
The method was to use actors.
Correct.
Who you say typically don't do as well as real folks. So go back to lesson number 1 and go find that female doctor if you want to be effective.
You want to find someone from the medical profession, because what Americans really want, are medical people making decisions on health care, not Washington bureaucrats.
Interesting stuff. I mean, fascinating insight. Thank you, Frank. Good luck with the book, okay? See you soon. Martha, what's coming up?
Well, you don't have to go overseas to join a terrorist